Modern technology and engineering have now made it possible to generate and transmit sonic vibratory energy through a handpiece to a root canal instrument. For more than a decade, Medidenta International Incorporated, in conjunction with Micro-Mega, a leading manufacturer of handpieces and accessories, have been in the forefront of dentistry's sonic revolution. In 1984, Medidenta International and Micro-Mega developed a fully autoclavable sonic handpiece, which to this day has remained the industry standard. The Sonic MM1500 Endo system, designed and engineered for your sonic success. Dr. Joe H. Camp is one of the nation's leading endodontists. Dr. Camp takes an in-depth look at using sonics in endodontics and demonstrates how the MM1500 will significantly increase clinical success while adhering to traditional tenets and principles of endodontics.
Hi, my name is Joe Camp. I'm in the private practice of endodontics in Charlotte, North Carolina, and have been since 1972. The area of endodontics has had some recent innovations which have really made doing endodontics a more pleasurable task. One of these was the introduction in 1984 by Micro-Mega Medidenta of the sonic instrument for instrumenting root canals. When I first saw this instrument and used it in an extracted tooth, I knew we were on to something good. I bought the instrument, I brought it into my practice at that time, and I have never done a tooth since then without using the sonic instrumentation. I have done at this point over 20,000 canals. I use it on every tooth. I find no situations where I can't get the instrument into the tooth to use it. It makes instrumenting of root canals much easier, it's more efficient, it's more effective, and it certainly is less fatiguing. There are things that you need to know about the instrument and how to use the instrument, and we're going to try to cover those in this tape so that we guide you through the use of the instrument so you can integrate it into your practice and make your approach to endodontics easy like we have using the Micro-Mega Medidenta Sonic.
The Sonic Air MM1500 Endo system was designed for use in every phase of canal preparation: cleansing, shaping, filling, and apical surgery, without ever having to change handpieces. Using a variety of easily interchangeable instruments, an operator is capable of systematically removing organic and inorganic debris from the canal system quicker and more thoroughly than with hand instrumentation or any other mechanical device.
Another of the great benefits of using sonic instrumentation for endodontics is that it allows you to clean the canal much more thoroughly. By the vibration of the instrument and the churning of the water within the canal, the cavitation of the water, or whatever irrigants you choose to use, you're able to reach areas of the canal that you cannot possibly reach with mechanical instrumentation. By doing this, you can have your liquid go into these areas and actually wash out debris, wash out pulp tissue, bacteria that you cannot reach with the hand instruments. Therefore, you wind up with a better root canal prep, a cleaner root canal prep, and you're able to do more successful endodontic treatment.
Since their development, endodontic vibratory systems have been thoroughly and rigorously tested. In more than 20 published studies by leading endodontists and universities worldwide, the Sonic Air was found to be superior to the other systems they tested, and was the most efficient and cost-effective, and was rated highest in operator satisfaction among the vibratory systems tested. The Sonic MM1500 is fully autoclavable, requiring very little maintenance. 1 drop of oil in the air intake hole every 5th autoclave is all the maintenance necessary. The MM1500 uses the same air pressure as your high-speed handpiece and utilizes the water from your unit for irrigation. No formal or complex installation is necessary, allowing the MM1500 to be easily used in any operatory. Once an instrument is locked into place, tuning the system is accomplished by slowly turning the tuning ring from the rest position or maximum green to the red position. The MM1500 is properly tuned when the visible vibrations of the instrument are agitating about half a millimeter on both sides of the rest position. The Sonic MM1500's unique design automatically allows water to flow into the canal. Use a sufficient amount of water to ensure maximum cavitation. Unlike traditional hand files, Sonic files have been designed to operate with less stress on the file, allowing for uses after sterilization. It is recommended that sizes 10 through 20 be used 1 to 3 times, and the larger files be discarded after a maximum of 5 uses. The Sonic, the most aggressive and efficient cutting instrument, utilizes 8 pointed cutting edges. The Sonic is available in sizes 10 through 40 in 2 lengths, 19 and 22 millimeters, and is the instrument of choice for penetrating and removing calcium hydroxide. The Sonic is a medium aggressive instrument made up of 16 rounded cutting edges. Although a medium aggressive instrument, the Sonic is used interchangeably with the Sonic as the main cutting instrument. The Sonic is available in sizes 10 through 40 in 2 lengths, 21 and 25 millimeters. The Sonic is a non-aggressive instrument used primarily for finishing and recapitulation. The Sonic's 3 beveled edges continue all the way to the working end of the instrument, and therefore has no safe end, as do the Sonic and Sonic. The Sonic is available in sizes 15 through 40 in 2 lengths, 21 and 25 millimeters. The Sonic filler literally spray paints the canal walls with sealer before placing a filling point. The Sonic filler is also very effective in placing calcium hydroxide in the canal. With the Sonic MM1500, there is no need to ever change handpieces for any Sonic instrument. The newest addition to the arsenal of MM1500 instrumentation is the Retrograde MM1500. The Retrograde was designed for retrograde preparation while removing a minimal amount of bone structure during the apicoectomy. For the Retrograde to work properly, there should be an existing canal, such as a tooth that has been previously instrumented, or in a tooth with a canal obstruction, such as a broken instrument. In these situations, the MM1500 does an excellent job, foregoing the need to set up an expensive ultrasonic machine.
We're going to prepare a lower right canine for root canal. This tooth had a carious pulp exposure, and it has a temporary filling in place. The first thing we're going to do, of course, is pass down the canal with a file, so we know that we have patency of our canal. Then we're going to establish our working length by placing the file and getting a radiograph at this point. We're going to use a 15 shaper as our first instrument, and we've set our length, which we've established radiographically, from our little gauge to the end of the file is 25 millimeters. Now this file can be set by moving the piece of plastic within the head as this is retracted, and we can set any length we want. Now our instrument is 25 millimeters long from the end of the shank, so we'll set it and it's automatically 25. There's also a 1.5 millimeter safe tip. Effectively, we'll be doing no cutting with a 1.5 millimeters, which is really what we want when we're doing a root canal, because we want to flare the canal out from the bottom upward with more flare in the top, but we like to have the safe tip on the end so that we're really not doing very much preparation in the end in the last 1.5 millimeters of the canal, and that'll be done with our hand instruments. Now we'll go into the tooth with the instrument, and we're going to be using copious water supply, as you can see, with our instrument. And the instrument is circumferentially moved around the canal with an up and down motion of 2 to 3 millimeters. And we're just circumferentially going around the canal and cleansing the walls. The vibratory action within the tooth will cause the water to flush against the walls, bringing out the debris, while the file is actually cutting the tooth structure also. And we'll go approximately 30 seconds with 15 files, constantly up and down with our motion and circumferentially around the canal. Now this will remove the pulp tissue and any debris that's in there. The forcing of the water that's inside there by the vibratory action will help remove tissue from lateral and accessory canals while we're doing this also. And we'll always go back into the tooth and recapitulate with a hand file. And you can see now the 20 easily passes. And even after we've just used the 15, the 25 file will pass down. And maybe even the 30. You can see the 30 file will go to place. Now we had a canal here which was probably a size 15 or 20 to start. And we can see that the 30 easily goes to place after just 30 seconds of use with the Sonic. At this point, there's really no benefit to using the 20 Sonic because we've already gone through the hand file recapitulating up to the 30. So we're going to move now to the 25 Sonic file. And then again, we're going to use this for about 30 seconds. Again, using the circumferential filing and going up and down 3 to 4 millimeters while we're doing this. Constantly moving, never stopping. I use these files aggressively. Now we're able to get a 35 file into the canal. And we're going to move to our Sonics now and go with our 30 and 35 Sonic. Okay, now we'll place the 30 file. Again, going right to the end of the shank and check it to make sure with our little measuring gauge that it's 25. And now we'll go with our number 30. And again, we're going to use it for about 30 seconds each. The amount of time that we're going to use the Sonic. Now notice how little hand instrumentation we've actually done here, that most of the instrumentation has been done with the Sonic files. Because these files are cutting the side of the wall. These are very sharp files, and you're able, but with the up and down motion, of course, in combination with the vibrations, to really file and plane those walls inside the tooth. We'll now go with our number 40 file. And now remember that we have the 1.5 millimeters of safe tip on our file, so we're going to have to prep by hand that last 1.5 millimeters. But basically, our canal is being prepped with the shaper in the Sonic, except for that last 1.5 millimeters. And what I'm doing right now is actually filing with the hand files to shape that last 1.5 millimeters. At this point, we're up to a size 40, and we're going to start a little bit of a step-back preparation at the end after we get to our 40. Okay, now we're going to place our number 40 file. Now we skipped the 35 because we really have already gone past that step, and there's no reason to use the extra instrument. And then we'll go in with our number 40, and you see how easily it goes to our length. Again, with the same circumferential filing, up and down, 3 or 4 millimeters, planing the walls all the way around the canal. What we're doing is creating a nice funnel form preparation that'll taper from the apical end all the way out occlusally. This will receive our gutta percha then. And then we're going to go in with a couple of hand files and create a little bit more of a step back. And we'll be through with our preparation. Again with our sodium hypochlorite. One of the advantages of the Micro-Mega 1500 Sonic handpiece is that you can use it without any water flow going through it. And then you could use any kind of irrigating medium that you wanted in the presence. So we're going to run the file, and you can notice now that we're actually introducing the sodium hypochlorite into the canal so that we're flushing the canal now sonically in the presence of sodium hypochlorite rather than water. And now we're doing a little bit of a step back. Our working length is 25. So what we've done now with the 50, we're back about maybe 3/4 of a millimeter. Then we'll go with our 55, and we'll back up here maybe to about 1 millimeter, again creating a stop at the end to receive our gutta percha. And now we'll go with our 60, and our 60 is going to go within 1.5 millimeters or 2 millimeters of the end. There we are. We're about 1.5 millimeters away from our end with creating a nice step back preparation. And we're through with our preparation. And now we'll irrigate again. Now as the final, we'll go back to our 40, which is 40 Sonic, which is still in the handpiece. And we're simply going to flush now. So you don't have to have very much action with the instrument while you're flushing. We're going to cut our water back on, and we're going to simply let the instrument flush any dental shaving or debris that we might have created from the walls of the canals, and we're going to do this for about 30 seconds. Okay, now we'll dry our canal with our paper points, and then our size 40 gutta percha. We'd like to get a little bit of tug back here. You can see the beautiful, nice preparation that we've created with a minimum of hand instrumentation. Okay, we're now going to put the sonic filler into our Micro-Mega 1500 to apply our cement. This is an instrument designed to carry the cement, and the vibration will help coat the walls. So we're going to coat our number 40 filler with the cement, as you can see. Insert it into our canal, and now we're going to just simply activate the handpiece. The vibration will coat the entire dental walls inside the canal with our sealer. And we'll now put our master cone to place with our sealer already in the canal. And now we'll get an x-ray to verify our master cone. By using the Micro-Mega 1500 Sonic, you're able to flare the canal and open it so that you can use any filling technique which you desire. By opening and removing the coronal dentin in the upper half or 2/3 of the canal, you're able to get down to the apical end, which is the most important aspect of the tooth. We don't want to destroy the root as we're getting to the apex. So we must remember that in teeth with curves, we must alter the files, we must bend them, we must pre-bend the files so that we follow the contour that's there. In my own hands, I'm able to do most of the flaring in most teeth using only a 15 and a 25 instrument. You can go through a series of files, 15, 20, 25, 30, 35, 40, and in some teeth, such as a big maxillary central incisor, you might want to go through all this series, whereas in a tooth that has a smaller root, such as a molar, and has some curvatures, you might only want to go with the 15 and the 25. This will be sufficient to open up the canal. Okay, we're now going to do tooth number 29, a lower second premolar. This tooth has a crown present, so we're going to make our access opening through the crown and then down through the tooth. We're now going to negotiate our canal. I have a number 10 hand file. We have pre-measured our canal, so we know it's approximately 21, 22 millimeters long. These are 21 millimeter instruments, and you can notice that we're now getting a little banding with the 15. See if it's possible for the number 20 to go. No, the number 20 doesn't want to quite seat. So we'll go back to our 15 and place our 15 file. We're now going to take an x-ray so that we can get our exact length, our working length, and then we'll clean it out with our Sonic 1500. I am using an instrument here which is one of the earlier types of Micro-Mega Sonic. This instrument has been in my practice in addition to about 10 or 12 like it.